Good afternoon, everyone. Thank you for attending this special meeting today here at Peterborough Public Health. I'd like to, first of all, just say with the snow, it's just wonderful that we're all able to attend this truly hybrid meeting, and that we're being safe on the screens and in places where you don't need to be driving, and the rest of us here at the Edwards meeting room. So. Thank you, and it is now 2:32. I'd like to call this special meeting to order, and I'd like to begin with the land acknowledgement, just being touched by the freshness of a season and how it covers us, and the idea of hope as we go into this season. We just want to respectfully acknowledge this land, the Treaty 20 and traditional territory of the Mississauga Anishinaabe. We offer our gratitude to the First Nations for their care for and teachings about our earth and our relations. And today we honor those teachings, and we welcome everyone, and that this may be just a special time of touching base on what we've worked so hard on in this year. And welcome to Matt Graham. Thank you for your attendance. And we're going to ask for a motion to confirm the agenda as we begin. Paul?
Well moved.
Yes, thank you. And Matthew seconding. All those in favor? Opposed? That is carried. And just want to know if there are any matters, declarations of a pecuniary interest. Seeing none. There are no consent items today that are to be considered separately. No delegations or presentations. And just in terms of confirmation of the minutes of our previous meeting, we'll bring forward minutes from the previous meetings to our December 11th agenda for approval. With that, no business arising from minutes and staff reports. I just as we begin, we want to just acknowledge that with our health unit merger approval, that we are working with today, and grateful for a letter from the province. It's a really pivotal moment today to just really acknowledge the hard work and the collaboration that each and every one of this table has been engaged in, as well as the team here at Peterborough Public Health. And to begin, I'd just like to say a special thanks to, of course, Dr. Piggott, our medical officer of health, and also all of the senior team, to Donna, to Hallie, to Alita, to Wendy, and all of the managers that have worked so diligently to prepare for what is upcoming. So thank you for that, and I would like to take us to the cover report. Over to you, Dr. Piggott.
Thank you so much, Joy, and sincere thanks to our senior team, and especially Larry. It's been a lot of legwork on him in the last little while. So thanks to the whole team, and I know this has been a stressful period for staff who have been waiting for some period of time. So I am really happy that we can share that on Monday we received a letter from the provincial government, a little bit later than we had hoped originally that to be, but nonetheless a letter confirming full approval of what we asked for in the refined budget that was returned to the province in summer. This is again in relation to the business case that we submitted together with HKPR District Health Unit April 2nd of this year. This is again in the context of the voluntary merger process, which has been ongoing since the announcement of this voluntary merger process last August 2023 at the AMO conference around this three-pronged strategy of strengthening the public health system. So our Board of Health, as you'll all know, went along the journey of considering the current context and some of the challenges that we've had in a longstanding way from a staffing capacity and from a financial standpoint of meeting the mandatory programs and services we deliver with the Ontario Public Health Standards. Health units, our health unit and health units across the province have struggled with without funding increases that have met inflation. And so this conversation about the merger has been on the background of a number of years of challenge and learnings from the COVID-19 pandemic of capacity challenges that public health units have. And so we're very pleased to share that the province has given us this letter, has expressed an interest in fully funding the proposal that we submitted. You'll see the funding letter, as is common for provincial funding letters, is an annual letter and process. And so that funding is for the first fiscal year, which runs from April 1st, 2024 to March 31st, 2025. And you'll see in the letter as well articulation of a commitment to out-year funding for what the province has described as a 3-year journey, which was a voluntary process, is a voluntary process, and is before the Board of Health for the final discussion and decision today. They have also articulated, clearly this is about strengthening public health. They've articulated that this is not about increasing costs, and in fact, they don't expect this to increase costs for local funders, municipalities, and First Nations. This is really about the province supporting strengthening of public health and any efficiencies, opportunities realized to be reinvested into the public health services that we deliver for the residents of our community. So I will just check if anyone else from our senior team, Larry, Donna, wants to add anything. I'm happy to walk through or answer any questions you may have. Happy to hear thoughts, and glad that we can get to this moment.
Thank you, Thomas. Just would like to ask if there are any folks that have questions or discussion about the report. Yes, Warden Clark.
Yes, Warden Clark. Yes.
Thank you, and through the chair. I am getting quite an echo here. I'm going to try to address that. There, is that better?
Too many boundaries.
Is that any better?
There seems to be an echo on your end, Warden Clark.
Okay, is that better? Okay, thank you. First of all, thank you to everyone that's worked on this, to Catherine, to Ron, to Joy, and all the staff. And when we do get to the motion, I would ask that we do have a recorded vote of the entire board. Joy, you are muted.
We're good. Can you hear me now, Bonnie?
Yes, yes.
Thank you. Further speakers? Further speakers? Okay. Well, we have we've had robust discussions, and even up until recently, this last week, I think there's a clarity and an understanding and a deep appreciation to the province for their response and their support of our merger to strengthen our public health in our region. And I'd just like to also acknowledge the partners that we've been working with at HKPR, and Chair David Marshall, and all of the Joint Merger Steering Committee that we've been meeting with regularly. And it's really been so forging to have the conversations and discussions to prepare for this possibility, and what a wonderful thing that it's in motion now. So with that, then we do have our motion, and the first motion we have is to receive the report and the letter from Minister Jones for information. So I see Dave Hickey, Councillor, thank you for moving. Seconder, Ron, thank you. All those in favor?
Aye.
Opposed? That is carried. Thank you. And moving along, we have a second motion, and I will just read it out loud. And it really does hit the reason we're here and where we're having our meeting. Whereas the Board of Health has received the public health funding and accountability agreement from the Ministry of Health that will provide a combined total of $10,129,450 in funding for fiscal year 2024-25 to Peterborough Public Health and Halliburton Kawartha Pine Ridge District Health Unit. Whereas the Ministry of Health included assurances that the government commits to 100% provincial funding support for this merger, and in principle, also provide commitment for eligible out-year merger costs, subject to regulatory changes and appropriate financial reporting. Whereas the Ministry of Health has articulated it is their intention that there are no fiscal impacts to municipalities and First Nations as a result of the merger. Whereas the merger intends to strengthen public health delivery, and the Ministry of Health has articulated that operational efficiencies are intended to support public health service delivery. Therefore, be it resolved that the Board of Health for Peterborough Public Health intends to pursue a merger with the Board of Health for Halliburton Kawartha Pine Ridge District Health Unit as outlined in the proposed provincial regulatory amendments to Regulation 553 and Regulation 559 of the Health Protection and Promotion Act, and provide notice to the Minister of Health, municipal, and First Nations councils to inform them of this intention. Do I have a mover?
I would like to move that, Joy, it's Bonnie, and ask for a recorded vote.
Thank you, Bonnie, and I saw your hand up second. Ron, seconding. And a recorded vote to proceed. Bonnie?
Yes.
Dan?
Yes.
Thank you. Dave?
Yes.
Hans?
Yes.
Katie?
Yes.
Keith? Keith Riel? You're muted, Keith.
Yes.
Thank you. Matthew?
Yes.
Noden?
Yes.
Thank you. Paul?
Let me just take myself off mute. Yes.
Ramesh?
Yes.
Ron?
Yes.
And myself, yes. Thank you. So moved. What a feeling. And we don't have any in-camera discussion for today. Motions for open session, none as well. And we have a meeting scheduled for December 11th, a Wednesday of next week at 5:30 p.m. here at Peterborough Public Health. So thank you, one and all. And just a yes.
Do we have to move to
Yes, we need to have a motion to adjourn.
motion?
Dave? Seconder?
Ramesh.
Okay, thank you, Ramesh. All those in favor?
Aye.
Aye.
Opposed? That is carried. Thank you, everyone. Congratulations.
Kind of anti-climatic. We're all working